Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. Here we have a female patient who presented with history of bleeding per rectum. We did her MRI of the pelvis. Here we can see there is circumferential growth involving rectum. This rectal growth can be assessed with the help of barium enema, CT examination and MRI. So these modalities can be used in assessing this lesion. Now in this case, we need to see the extent of the disease. Most important thing is that we have to inform our surgeon that how much rectum and anal canal is spared. Here we can see that this lower portion of the rectum and adjacent upper anal canal is spared. So we will measure this region and mention it in our report. We will also comment on exact length of the lesion. Similarly, we will mention perirectal space involvement and involvement of adjacent surrounding viscera. Like in this patient, we see that uterus is pressed anteriorly and there is indistinct interface along posterior aspect of uterus from the growth. This can also be confirmed on coronal images. This one is uterus which is displaced and compressed by the mass lesion, and intervening fat planes are lost. So this is very important that we have to rule out involvement of adjacent viscera. Unibladder is unremarkable. It is smooth walled. Similarly, in this pre-sacral space, major portion of this area is clear, and bony boundaries, they are unremarkable. SI joints and hip joints are normal. So disease doesn't extend up to pelvic bony boundaries. Pelvic muscles are spared as well, and there is no free fluid or ascites. There is no pathological pelvic lymphadenopathy. So these things need to be addressed. So to summarize, this is an example of carcinoma of the rectum. How many modalities can be used for its assessment? Preliminary, we can use barium enema, and second modality, which is very good, is CT scan, having both oral and heavy contrast for the assessment of extent of disease, that is assessment of staging process. For this we will include abdomen and pelvis. Third modality is MRI. So we can use these modalities for the assessment of CA of the rectum, and we have to comment about size of the lesion, its perirectal extent, involvement of adjacent viscera, abnormal lymph nodes, ascites, metastatic foci in adjacent surrounding bony pelvis. Similarly, assessment of the chest, abdomen is also important to rule out metastatic foci in these areas with the help of CT scan. Thank you so much. Assalamu alaikum wa rahmatullah.